Hi, I'm Cathryn Harbor, and I want to explain how I'm treating illnesses, particularly Lyme disease and Lyme disease associated illnesses now. I used to treat with a lot of antibiotics, and recently I have come across an approach that lets me get people better than I was getting them using fewer antibiotics than I was using before. So that's pretty exciting. But it's a little bit complicated. In fact, it's very complicated. So I'm going to suggest that you follow along with me. I'm using an approach that was developed by Dr. SHoemaker, SHoemaker, and you can find it on his website, which is called survivingmold.com. Dr. SHoemaker believes, and I think he's right, that when people are ill with Lyme, the real problem isn't the bacteria making the immune system flare up, but toxins made by the bacteria making the immune system flare up. So I want to explain what happens. Over here on the right, you can see what happens to a typical person when they have an illness that causes toxins to be formed. Lyme, as it's going through its metabolic processes, puts off a lot of toxins that are really annoying to the immune system. And when these toxins are in your body, the immune system reacts to them by the kind of inflammation that gives you the symptoms that you're experiencing if you have Lyme, and particularly if you've had Lyme for a long time and you're very, very sick. Normal people, when they get the toxins from Lyme or from mold, there are many other things besides Lyme that create a similar toxin or a toxin that needs to be cleared in a similar way. When these toxins are in your body has to get rid of them, and it has two mechanisms for getting rid of them. The immune system can bind them, churn them up, process them, and then make antibodies against them. That's the most efficient way, and that's something that most of us can do, but the illest of my patients cannot do. And that's actually the problem, is some people genetically lack the immune system ability to remove toxins that are made by Lyme and by mold and some other things. Those people rely only on the second way that we have of removing toxins, and that way is through the liver. So their bodies, as the toxins go through the liver in the circulation, the liver binds the toxins, puts them into the bile, and the toxins are excreted in the bile. The problem with relying on that system is that if you have too much toxin, it gets overloaded, and when you put toxins into the bile, the body likes to reabsorb the bile because that conserves matter, and so the toxins come back in. So your liver clears them out, your body reabsorbs them, and the toxins go around and around, and you don't have the immune system kicking in and helping you. So what you have is a buildup of toxins. So normal people, or people like 80% of people go through the pathway that is pretty good at inactivating Lyme, and that's why some people never get Lyme, even when they've been bitten. And other people have a genetic susceptibility to getting very sick in the context of Lyme. And I believe that Dr. SHoemaker is right, that the reason they're getting sick is these biotoxins. Once the biotoxins are building up in the body, they cause all sorts of havoc, not just what they do. They annoy axons, they annoy the nerves so that people get pain. They bind to immune system cells and cause those immune system cells to put out other molecules of inflammation that cause the capillaries in the body to become less open, so that there's less blood flow to the tissues. People, when they have that problem, when they exercise, they're not delivering enough oxygen to their muscles, and they get a lot of pain in their muscles for the next several days after exercising, simply because there's a buildup of lactic acid because the capillaries aren't perfusing well. Another thing that happens in the immune system of these people is that the immune system starts making antibodies against things that normally you shouldn't make antibodies against, like the body itself. I believe some autoimmune problems, if not most autoimmune problems, are caused by a buildup of toxins of some sort. I actually think mold is as big a problem in most people as Lyme is. And certainly if you're not clearing one well or the other well, you're going to get behind the 8 ball. So if you have Lyme and you're in an environment with mold or in a water damaged building, you are going to have a difficult time getting well. Or if you've been exposed to mold for a long time and suddenly you get Lyme, it's going to make you very, very ill. It'll just put your immune system over the edge. Okay. In addition to making your bodies create antibodies, these biotoxins create all sorts of inflammation that gives you aches and pains in your joints, in your lungs. It dysregulates the heartbeat. It makes it harder for you to fight other infections. And in many people, it causes dysregulation of fluid balance. So people's blood pressure goes too low, and they find themselves craving water. And some people even notice that they get electrostatic shocks when they touch metals. In addition to all that, the biotoxins affect the immune system. The endocrine system. They cause a change in certain hormones. The hormones that Dr. SHoemaker measures and is fairly certain are changed by this, and I find that he's correct when I measure this in my patients, are vascular endothelial peptide, VIP, and MSH. When those hormones get damaged and go low, you get disturbances of sleep, you get chronic pain, you get gastrointestinal problems that make you even more likely to have difficulty digesting wheat. You find that any illness you have is prolonged and you get sicker and sicker. It also affects your adrenals, so that your fight or flight system is super activated. People find that they're a lot more anxious when they have these biotoxins on board causing inflammation. So what Dr. SHoemaker does is he does a series of tests. He tests the genetic type to make sure that you are one of these people who isn't clearing the toxins well. And then he has a very structured step-by-step way that after he removes the toxins, which is the first thing he does, that he slowly restores the body to health. I have found that his approach is quite miraculous. And in fact, one of the things that's the most important about it is just making people aware that when they have Lyme and they have mold in their environment, they are not going to get well until the mold in their environment is gone. That is already a huge step in getting people well. The first thing he does in terms of clearing the toxins is to bind them with questran, which is cholestyramine. That is a drug that's used to clear cholesterol from the body. And what it does is, remember we said that when the immune system isn't inactivating toxins, the toxins are all inactivated in the body by the liver and then put into the gallbladder and excreted in the bile. The cholestyramine simply binds the bile so that rather than being reabsorbed, those toxins that have already been cleared by the liver can get out in the bile. So that's sort of the start, and that's the background, and pretty much the way, at this point, the way I'm treating most people who have Lyme disease is to assume that what they have is a dysregulated immune system and a problem that Dr. SHoemaker would call the systemic inflammatory response syndrome. That's it. I'm not sure how to end that.